But hospital-acquired thrombosis is nothing short of a public health emergency. We're talking about a preventable condition which kills up to 25,000 people a year across the United Kingdom. Now, to put that in context, that's more than the total number of people who die from breast cancer, HIV and road traffic accidents in a year. Every patient who comes into hospital is at risk of hospital-acquired thrombosis, so we need to risk assess them, and we've developed the All Wales Risk Assessment Tool, which is an evidence-based tool which allows us to identify those at greatest risk, and those people can then be given preventative measures or thromboprophylaxis.
It's important to screen for thrombosis because the sort of patients we have admitted to our ward or to any ward in any hospital, there's a high risk of thrombosis in certain groups of patients. We assess patients as soon as they come in, and we use this yellow form which goes into the next to the patient's drug sheet. And every patient, it's part of the patient admission pack, so every patient who comes in we fill out one of these forms. And it consists of two parts. The front part is to do with patients with medical conditions, and the other part is patients who are transferred following surgery.
Sometimes when I'm checking, I'll find that the forms haven't been filled in. If there's a doctor on duty at the time, which is Monday to Friday here, I'll go and ask them. Failing that, I'll take the yellow form out and put it in the doctor's diary with a little note. Reassessment
takes place within 48 hours of the patient arriving, as close to it as possible.
Patient care has been improved since this has come into post, because I think we're all aware at every level of staff that these things need to be monitored and sort of kept a check on.
Patients will react very positively generally to this programme.
The figures alone prove that by monitoring these patients that lives are being saved that would have otherwise been lost.
I think it's exciting because the evidence is that if the appropriate patients receive thromboprophylaxis on admission to hospital, they're much less likely to develop deep vein thrombosis during their stay.
Reducing hospital-acquired thrombosis will actually allow us to reduce waste, harm and variation.
Checking for thrombosis reduces waste, it helps the patient have a shorter stay in hospital and also reduces the risks for maybe further surgery, and basically it's just getting them on the road to recovery much quicker.
It's all designed to save lives, and save lives that might otherwise be unnecessarily lost. Because it's a project that's designed to reduce harm to patients, and we would hope as the project gets spread right across the country that we will see a great reduction in the numbers of patients who come to harm.
By using the form when patients are admitted, it means that there's no variation in the care that the patients receive in our hospital.
1,000 Lives Plus works because it puts patients at the forefront of everything we do. I think it also encourages ownership from every healthcare professional to be part of it. And by doing that, you know that as an individual, you can make a small difference, but as an organisation, therefore, you collectively make a huge difference.